Welcome to Spoonful of Strength, a podcast for people with chronic illness and the ones who love them.
The compassion that you guys have really shines through.
Rachel and Tina cultivate a sense of comfort.
It was such a rewarding experience.
They were great hosts.
It was amazing. You are so kind.
Spoonful of Strength has given us this great platform.
They were so welcoming.
Here are your hosts, Rachel and Tina.
Welcome to this week's episode of Spoonful of Strength. This week we're talking about living with multiple chronic illnesses. And our guest today is going to be Dave. He's talking about his journey with diabetes and epilepsy. So he'll be joining us in just a little bit. So how have you been doing, Rachel? I feel like even though we saw each other just less than a couple weeks ago, I feel like we haven't sat down and chatted and recorded anything in a bit.
Yeah, we took a week off while you were in Indiana, and it does. It feels like forever. Things have been a little bit crazy. Last week was really crazy, and this week's getting to be was a little busier than I thought, but doing pretty good. I've got my neuromuscular doctor's appointment coming up next week, so I'm getting all the medical, getting a lot of test results and getting all the doctors to send over information to him and getting the MRI images and all of that so that I'm prepared because, we only have a limited amount of time. So I'm looking forward to that appointment and hoping that he can help, with all the muscular issues that are going on. So how about you?
Hopefully you'll get some answers.
Yeah, it would be nice to get some answers and as far as everything that's been going on. But how have you been doing? You spent a week in Indiana and
yeah.
Yep. How's your week been?
It's okay. I've been struggling a bit with just decompressing for some reason from the trip more so than usual. So, but I think it might just there's just a lot going on. So it's, not, it took a lot out of me though, the Can-Am this year.
Yeah.
It's like three days of being on the feet on hard concrete. And boy, my body was sore.
Yeah. We got to visit Tina for just a short time. And I don't know, I think it may be because you had another animal, but it just seemed like you didn't have any downtime for anything. It was one race and then, maybe 10 minutes and then you were right back at it. And I know that vending was really, really hard. That adds an extra layer on top of that, plus all the planning that you had to go through and everything. I think that made it a lot more difficult.
Yeah. My vending booth was very busy, so that was a good thing, but it was also a tough thing. Was my sister and her grandson were there to help, but they were also helping the team. So every time I had to leave the booth to go race, they were also there. So I think next year, if I vend again, I've done it 2 years in a row. But if I do it again, I'll definitely try to find somebody that can just be dedicated at my vending space, and I just pop in for questions or whatever if I end up doing that again next year. I mean, it was successful, so it's hard for me to not to. There you go. It's tough to make the decision to say, you know what, it's too much to do when it's so successful to do. So, it essentially pays for my trip out there and back and a little bit of pocket cash to go shopping myself with all the other vendors. But usually I was so busy, I didn't even get a chance to shop the other vendors. Slowly decompressing. Next week it's time to put our camper to bed for the winter. So I'm a little sad about that. But
yeah. But hopefully you'll get some downtime with nature and everything just to decompress and everything.
Yeah.
I know this episode airs a few days after November, But we want to take a moment and talk about the November Awareness Days. We have Alzheimer's Disease Awareness Month coming in November, as well as Carcinoid Cancer Awareness Month. We also have COPD and CRPS Awareness Month. That's Complex Regional Pain Syndrome. We have Diabetes Awareness Month that I will be spreading awareness for, as well as Diabetic Eye Disease Month. Epilepsy Awareness Month is also in November, as well as FOXG1 Awareness Month.
And also we have gastric cancer and stomach cancer awareness month, GERD awareness month, lung cancer awareness month, National Family Caregivers Month, oral cancer awareness month, pancreatic cancer awareness month, pulmonary hypertension awareness month, and TMJ awareness month, which I never knew they had an awareness month for TMJ. I've had TMJ for many, many, many years.
Yeah.
Yeah, usually it's pretty, as soon as I close my mouth, my jaw is out of place. I had actually looked into surgery or went to a doctor to inquire about having surgery to fix it, and they told me that if it's not causing pain and it's just more of the clicking and the annoyance, they didn't recommend it because they said there's just so many nerve endings in your face that surgery could actually end up causing more pain than helping. So,
Wow. Yeah, I don't think I knew that you had TMJ.
Yeah. And when they did it was interesting because when they did the imaging, I always thought it was just left because that's where I hear the clicking and can feel it. But they actually said my right jaw was worse because there was no cartilage over there, where what's causing the clicking and popping sounds on the left is that there's just enough in there that that's what's causing the sound. So
Wow.
Sometimes I have so many other things going on that at TMJ, it doesn't even cross my mind anymore because it's been so many years with it that I was like, I have TMJ.
Well, it's funny that you say that because, we're talking today about having more than one illness. And I think a lot of times when you have more than one, there's always one that's dropping off that either you don't take care of very well, or it's maybe not as symptomatic. It was interesting that you said that, but as Tina said, we're going to talk about having multiple chronic illnesses, and I wanted to look up just to see what the numbers said. And I did find in a 2022 study that almost half of the population are living with chronic condition, and 40% of adults suffer from 2 or more, which I thought that was kind of crazy. I don't know why
that's way higher than I thought it would be.
Yeah, me too. And I did run a poll through Instagram about how many chronic illnesses people have that follow Spoonful of Strength. And we had 11% say just one. And 78% said 3 to 4 different chronic illnesses, with another 11% saying 5 or more.
Wow.
And yeah, it's absolutely crazy how you get that first one and then it's almost like you're susceptible to getting more. And so I acknowledge the fact that a lot of us are dealing with, not just one illness, but, potentially 4 or 5.
After you've been diagnosed with a couple and you're just like, really another one is cropping up, like how many more am I supposed to try to manage?
I've said that before.
Yeah, I do. I remember that phone call actually when they were telling you that there may be a non-MS related muscle disease going on. And that's got to be tough. And sometimes the one chronic illness will cause others, which is what we'll find when we in the case with Dave.
Mm-hmm. Yeah. Yeah. And, like I say a lot, and I think it's even on my Instagram page, I have type 1 diabetes and MS. And those are like the main two. But if I really sat on it and I say, well, I have asthma as well. Let me see, I have chronic bronchitis. I have weakness in my lungs. I have colonic inertia. And, so there's so many things that more, but sometimes at least what I do is the two main ones, I guess, are the ones that I talk about the most, just because they're the ones that are most visible in my day-to-day
And
life.
some of them you don't live on a daily basis. They subside or they go into remission and then they come back up. So it's easy to forget. Like, because I when I think about the chronic illnesses that I have, fibromyalgia usually comes to my mind initially because I lived with it for so long, but for the most part it had been I don't have flares very often, but the colitis, like I was diagnosed with colitis last year as a result from the Keytruda that I was on. And so actually it was longer than a year ago, a couple years ago, I guess. And, I lived a year with it being undiagnosed and not being able to eat much and not wanting to eat or just skipping meals because I needed to go out and do errands. And I'm like, I'm starving, but I've got to be able to go to the store so I can't eat anything because it's going to hit me when I'm at the store. But now that they finally have it under remission, it doesn't cross my mind anymore.
When you have more than one chronic illness, you kind of get an overlap of symptoms. I know sometimes with, again, just the diabetes and the MS that are more prominent for me, if my blood sugar's high, that creates stress in my body, which can flare my MS symptoms. And so sometimes they're like working against each other. And that's when it gets super, frustrating, is when one thing then causes something else to trigger, and it's just going back and forth.
Right. Yeah. It's it can be tough to manage, especially if some of the medications or therapies that they do to manage one of them exasperates some of the other.
Yeah. Yeah. And I had my rheumatologist who has been kind of helping me navigate through all the muscle issues. He's like, well, it could be this, but if it is this, it's going to be impossible to treat you for it, because you're going to have to choose whether or not to treat your MS or your, I think he was looking at possibly like a scleroderma or a myopathy. And he said, you might have something like this, but, at that point, am I going to have to decide, which one is more important and which one gets treated? Because he said the medicines don't interact well with each other. And so
they counteract each other.
Yeah. And so it can cause a lot more issues. And nobody wants to be in a position where you have to kind of say, well, which one's more important, or not being able to treat one. But I know that happens as well.
Yeah. Yeah. I can't imagine having to say, okay, so do I want to keep my MS under control, or do I want to feel better on this side? And it's frustrating. And a little bit devastating, I'm sure, to be in the position of feeling like, okay, I've got so many things that now they've just told me that I wouldn't be able to treat this.
Yeah. I had that actually with even regular medicine. I have the muscle weakness going on, but then I also have a lot of stiffness. And for stiffness, they usually give you a muscle relaxer. And they say, well, we can't give you a muscle relaxer because that's going to make your muscle weakness worse.
Right.
So I've been in that position where they're like, we don't, you're just going to have to deal with it, because we don't want to make one thing, worse
than the other. Right. Yeah.
Yeah.
That's tough. Right. It was funny because when you were saying that, I was going to say, when you said stiffness, I was about to say, well, I bet you can't take muscle relaxers then for that.
Yeah.
So.
Yeah. but I had been on just a muscle relaxer at night just to help with sleeping. But we recently, took that off, but it's just crazy how things work. Ed says a lot to me. He goes, well, he says two things. He said, did your mom smoke crack when you were, when she was pregnant with you? And because all of my siblings and, everybody's healthy in my family. And the other thing he says is, what in the world did you do? Who did you make mad to cause all of this havoc in your body? But
Dave will give me a hard time when I get up off that, like lately, especially since Can-Am. Like I said, it was really hard on my body, and I think I'm having a fibro flare up, a small fibro flare up, and it's been a while since I've had one. But I get up and I walk like an 80-year-old woman across, initially until I get going, and he's just like, woman, like, what is up with you? He's like, I hooked up with, like, we're 6 years apart. He's like, I hooked up with a younger woman so that she could take care of me, not the other way around. Of course, he's just
Ed and
kidding.
I have a couple more years than that. We're a little bit more spread out than that, but
not too much though. Not too crazy.
Yeah. It's funny. I have to tell this story. This was pre-MS, but we still to this day, you have those memories where a story and you just recount it so many times because it's so funny. And Jaron, who's my youngest, he's 18 now, but he was maybe 5. And I was sitting on the floor playing with him. I went to get up and I made a noise getting up. You know how and he goes, Mommy, why'd you make that noise? And I said, oh, Mommy's just old and fat. And he goes, you're not old. I was like, are you calling me fat?
Yeah. Out of the mouths of babe.
Yeah. So we still.
That's you need to do. If they still do that, isn't that a Reader's Digest, an actual Reader's Digest column or something? Is out of the mouths of babe. Should have put that in there.
Just those things that you just were always joking about. Yeah, you're not old. Yeah. But
you're not old.
Yeah. But I wonder. Our last episode was about advocacy, and I started thinking about the fact that when you have more than one illness, how it's even more important to be an advocate because you have to constantly be checking to make sure that everybody knows about everything that's going on. So I have a gastroenterologist, I have an endocrinologist, I have a neurologist, I have a pulmonologist, I have all of these different doctors, and they all need to know what's going on. And you have to be able to keep everything working. Like I have my GP, but I don't think I utilize him enough. But I feel like when you have more than one illness, is it smart to have like one doctor that handles everything or somehow coordinates everything? Because I always worry about the doctors not understanding everything that's going on. So maybe they're putting me on a medicine that's going to hurt this or that. Does that make sense?
And absolutely. It definitely makes sense on that. And it's a tough situation because you end up with so many specialists. If you have great ones, I know, you may be able to get them to all kind of work together and compare notes. I know when I was going through my cancer treatments, my oncologist and my urologist, pinged back and forth constantly. But of course I was one of those that they're like, we don't know what to do. So they were brainstorming back and forth, but they also would keep each other, throughout the treatments and up through my surgery. They would, I'd show up for one and they're like, oh yeah, I talked to Dr. So-and-so, the other day, and she told me blah, blah, blah. So I knew that team for me was really good and that they worked together. But I think that's not necessarily the norm. I think I just got lucky that I had two really good specialists that had my best interests. Or is there an outside, some sort of, the problem with trying to what for a GP to do that is I feel like I haven't seen my GPs for a number of years because it's just so difficult to get in. And a lot of times I'll call to try to make an appointment. Like if I think I have a UTI or, something going on, and majority of the time they'll say, we can't get you in, just go to one of the clinics. So I don't even try to go there majority of the time anymore because, I can't get in because a lot of GPs are just so overwhelmed. And even when I do go in to see them, it's rush. Like, okay, you got 15, they may keep you waiting for like an hour after later than what your appointment time is, but you only get like 10, 15 minutes tops, and you don't even get an opportunity to, if you're in there because you think you scratched your cornea, then that's the only thing you're going to be able to talk to them about. I don't know the best way to manage multiple doctors to make sure that they're all on the same, or not necessarily the same page, but similar pages. That one of them isn't tearing a page out of the book from another doctor, so to speak.
Yeah. And if you all have any comments as far as that's concerned, how you manage multiple doctors, definitely send us a comment and let us know. Now, Tina, I know they have internal medicine doctors, and I wonder if that would be a good doctor to be able to manage everything, because I have good doctors. One doctor in particular always ask, what's your MS medicine? Because I think he feels like that's the most important thing I've got going on right now, and always make sure that if I'm having stomach issues, that it's not related to the MS drug. And one time I was having really bad stomach issues, and he asked me what my MS medicine was, and I told him, and he researched it, and he said, you got to tell your neurologist, we got to change that, because that's what's causing, your issues. And I appreciated the fact that he was looking at the other things I had going on in my life. So,
right.
But those are hard to find, I think, sometimes.
Yeah.
Sometimes
yeah,
doctors don't like talking back and forth, and me, I've got like 4 or 5 main specialty doctors, and so it's almost impossible to make sure everybody understands what's going on. And so I think being an advocate is even more important when you're dealing with all of that. But
yeah, it's every time something would come up and I'd have to go see another doctor, I'm like, I'm just, here I am collecting specialists. I have my ENT because one of the chemo drugs caused hearing loss, and I had, a cardiologist because back before my knee surgery in 2016, I couldn't pass cardiac clearance, and so they discovered a left bundle branch blockage, and I completely forgot about that until it happened to show up on my Facebook memories when I was talking about that, and I'm like, oh, I need to go in there and actually get another checkup for that. And then I've got, my allergist and my oncologist and my urologist and my regular doctor. And, sometimes it's even tough to keep track of, okay, I know I have an appointment, but who is it that I'm supposed to be seeing, and what is it for?
Yeah. I had to start putting in my phone contacts, like Dr. Perry / endocrinology, Dr. Harrison / gastro. So that because I couldn't remember who was who and everything. Join Spoonful of Strength on Instagram, a community open to everyone. Whether you have a chronic illness or support someone who does, you are welcome at Spoonful of Strength. You'll get preview clips of the upcoming episodes and insight into my world as a spoonie. That's Spoonful of Strength, spoonful with 2 L's, on Instagram. The one thing the one thing that I wanted to talk about is the mental health part of having more than one issue. And again, I did a little bit of research, not to be all, I'm trying to be book smart or anything, but I thought this was really, really interesting. So the risk of depression alone is usually 10 to 25% for women and 5 to 12% for men. But people with chronic illness face a higher risk, which is between 25 and 33. And it says Parkinson's disease has a 40% depression rate. MS has a 40% depression rate. Cancer has a 25% depression rate. Diabetes, 25%, and chronic pain, 30 to 50%. And I thought that was really interesting that they're seeing the link between a chronic illness and the mental side.
Yeah. That's very interesting. But I can see it too.
Yeah.
For sure, especially like with the Parkinson's and the MS, because those are, that's a deteriorative, you deteriorate over time.
Yeah.
With that, for many, not most, but for many, and it'd be interesting. I'm wondering about like Alzheimer's and dementia, like the early stages of it when they're aware. I feel like eventually as it progresses, that awareness, or ALS or things like that, where, the cancer is probably, it would be interesting if they expanded that with the timeline of how long it lasted as well.
And I also think maybe they're putting all of cancer in one bucket, whereas there's so many different types of cancer.
Yeah, there's so many different types, stages. And there's, and stages, a stage 1 person may, I can't really say that because I know that it's just as scary. I could see that, no matter what the stage initially.
Yeah.
But I could also see that once you're past that and you've gotten that all clear, that might subside some.
Yeah. And my mental health has been a lot better the last couple years. But I still have probably maybe once a week, maybe once every few weeks, just have like a complete meltdown of just dealing with more than one. And we recorded Dave's interview yesterday, and so we're kind of doing things a little bit backwards, but he said something that was so interesting to this topic and I related to so much. He was talking about the fact that he has diabetes and epilepsy and how sometimes they take turns. I know for myself, today has been a really bad diabetes day. For some reason, my blood sugar was way out of control this morning. And so my focus was on that more so. And then, the blood sugar now is fine, but now, this is going to come up and then this is going to come up. And sometimes it's like, I just want to break from everything. Like, give me a break where I'm not dealing with everything all at once. And then you have those days where everything is flaring all at once because your blood sugar is high, which is causing stress on your body. And maybe it's high because you're sick. And then that puts stress on the MS, and the MS symptoms flare, and it's all like a tornado. And I still probably, like I said, once a week, maybe once every 2 weeks, just have a complete meltdown of just, I'm so tired. I'm just really struggling with not feeling peace of my body just feeling good. I just want one day where nothing hurts, and I say that quite a bit. I just give me one day where nothing is flaring up and bothering me. And so I'm sure that, people with multiple chronic illnesses, it's just overwhelming at some points that you just can't get away from anything. Because I think if I just had diabetes, I had diabetes alone for 15 years without any other illness. And, it had its times where it was struggling and it was high and I had to deal with things. But for the most part, I led a relatively normal life.
Right. Yeah. And having to make those adjustments now is tough. I remember one thing when our dad was still alive. I remember him. One thing he used to always say was, "I'm sick and tired of feeling sick and tired."
Yeah. It's so
'cause he went.
true. I could see him saying that.
Yep. Yeah. Because he went
Yeah.
through a lot. I
Certainly.
can't imagine, living as many, what is it, 26 years with just the one lung, and just constantly not being able to be out there and be active with your kids or your grandkids. And, anytime just a simple cold can like just knock you down, knock him down on his, for, days. Pneumonia was always life-threatening for him. Although he used to joke and say that he never had to worry about getting double pneumonia, but
Oh my gosh. Oh, that's funny. That's funny. And Ed always asks me when I'm having these meltdowns, why today? Like, why is it bothering you today? You've been strong for a week, and what happened today? And I tell him, I said, every day it's just like one more boulder on your back, and you just deal with it and you deal with it. And it's just that straw that breaks the camel's back that you're like,
yeah, there's just something. Yeah.
Yeah.
It's just, you just finally hit that boiling point, so to speak.
Yeah.
That happened to me a few weeks ago when I was trying to get ready for Can-Am, and I was having issues with my sublimation printer, because here I am, big show, trying to get ready to vend at, and my printer was giving me issues, and I just completely melted down. I'm like, I think I cried for like 3 hours over a printer, but I know it wasn't over the printer. It was just the printer was the catalyst of what was already building up with everything else.
Yeah.
So
a lot of it's fatigue and stress and sleep.
Yeah.
All of that takes into consideration everything that's going on in your body. But yeah, so I think in closing is just having the two chronic illnesses is just a lot more difficult, and realizing how many people really truly have to deal with more than one, and sometimes 3, 4, 5, just shows how strong the chronic illness community is. But I'm excited to get Dave in. Should I tell the story, since I already blurted out that we recorded Dave yesterday, and schedule wise we just had to postpone this first part, but this is a chronic illness cognitive blooper, we shall say. Dave was so nice to come on and talk to us, and we said goodbye, and he got off the Zoom call, and first thing I said is, I am so stupid. And I was just laughing. But so most of the time I talk to our spoonies via Instagram. And so I can kind of see a little bit about the person and their life and all of that. Well, he and I were set up, I guess, through another spoonie that did an interview for a season. And so we were communicating back and forth via email. And his email address was DR and his last name. And so I was like, oh my gosh, he's a doctor. Isn't that nice? We're going to interview this. We're going to interview this doctor, and it's going to be. So I even told Tina, he's a doctor, we got to. And I even put on like the notes that we have for the show, Dr. Dave. And I'm talking about all of this. So I'm interviewing him, and he's talking about where he went to school and all of these things. And I'm like, I didn't hear anything about medical school. That's kind of odd. So I asked him, well, what do you do for a living? And he said he was an engineer. And I thought, so I'm thinking in my head as we're doing this, I'm like, how did I finally realized DR are his initials, his first name and his middle name. He's not a doctor. So as I'm doing this, as we're doing this interview, I'm like, please, because I think you had to walk out for a quick second while he was answering that particular part. And so I was like, oh gosh, please, Tina, don't come back and say, well, I heard you're a doctor or something like that. I was praying that you weren't that. Oh my gosh. So
thankfully I didn't wander too far away. I think I just had to step aside to check on a dog. I think I heard some suspicious noise from the living room. So I heard him say engineer. So
okay, good. I was so worried. I was like, And now he knows, and everybody
Yep.
knows that.
Yep. Now everybody knows.
Everybody knows. One thing about me is I don't really care about putting all the stupid stories of things that I do out there, because I know we all relate to all of that. But Dave's interview is
those
really
cognitive issues are like no joke.
No joke. And I think our last episode with Bill, he really touched on that. And so if you haven't listened to that episode with Bill talking about his neurosarcoidosis, he talks a lot about cognitive issues as well. So let's get Dave's interview going so you all can hear what an amazing individual he is. So let's have a listen to Dave's interview.
Welcome to our podcast, David. Thank you so much for joining us. We appreciate having you here.
Of course, glad to be here.
Why don't you share a little bit with our listeners about you, where you're from?
I am originally from East Orange, New Jersey. That was where I was living when I first got diagnosed with type 1 diabetes. I was 5 years old at the time. After New Jersey, I moved to Pennsylvania. I lived there until during middle school. I moved to Pennsylvania, to Stroudsburg, Pennsylvania. And then that's where I was living when I had my first seizure, which was caused by my diabetes. I had a really bad low blood sugar that I couldn't feel that my blood sugar was low, and it hit me pretty early in the morning. And after that, I moved to Connecticut for a little while, and I moved down to Delaware. I went to school in Connecticut for a little while. Okay, now went to school in Delaware for a few years. Once I finished, graduated school, I went to a few colleges, but I eventually graduated from Del Tech, and then went and worked in Philly for a few years, and then I came back to Delaware, where I've been ever since.
Mm-hmm. What do you do for a living?
I am now an engineering technician at Hologic. It's a company that makes mammogram machines.
Okay. Well, I'm a type 1 diabetic too. I wasn't.
Oh, okay.
I wasn't diagnosed till I was 21, so I was in a kind of a weird age. But I'm very familiar with the diabetes. You were diagnosed at 5 years old. Do you remember? I mean, I'm sure you can't even remember a time where you didn't have diabetes. So it's been with you all this time. What was that like growing up, having to deal with? Did you have like an insulin pump, or did you do shots? Like, what was childhood and your younger years like dealing with diabetes? I'm sure that was probably your parents, doing a lot of the work. But
yes, when I was first diagnosed with diabetes, insulin pumps weren't really a thing yet. Insulin pens were still very new, so I was still on just vial and syringe. And it was mostly my parents. I was only 5. I was 5 years old, so my parents were. My mom mostly did my shots for me. I was very, being a child, with needles, I was very uncooperative. I did not fully really understand why I needed to take shots, just that I did know I needed to take them. That did not make it any easier. I was cooperative up until the needle got very close to my skin and I got very combative. I actually really, it had to be so hard for my parents, because every time I need to take insulin, basically we had to go to a family member's house, usually my grandmother. And so my grandmother had it was sort of like a boarding house, but it was all family that lived in the house. We go over there, and it was twice a day, every day. It was a ceremony. They'd bring me over, and someone would have a family member hold down each limb, and then give me an injection. And then all right, thanks. And continue with the day. That was every day for years until I got better at letting my parents give me the injection, and then eventually able to do the injections myself.
Mm-hmm. How scary. I mean, I could imagine having PTSD or something from that, because at that age you just don't understand. And I couldn't imagine having to deal with that at a young age.
No, and also back then, so this was in 1995. So like the really short, ultra fine needles weren't invented yet. They were longer, a little bit bigger. They look, I mean, to a child, any needle looks massive. And to people who had to take insulin prior to that, I've met people who are like older diabetics who had to use the old glass syringes, where the needle was like 2 inches long, or like if you didn't have enough body fat, you had to put it in at an angle to not pierce your organs. So I've talked to some of those guys. So they had legitimately massive needles, but to me at 5 years old, that one, it looked massive.
How were your school years as you were maneuvering through that?
So school was actually slightly easier because, so 5 years old, I believe that's kindergarten. So I first started kindergarten. I was newly diabetic. So I got diagnosed in August of 1995. In February of 1996, about halfway through kindergarten, my twin brother, was also diagnosed with type 1 diabetes.
Really?
Yes. So I wasn't so solo in it anymore. I wasn't as alone. Now for him, he had it a little bit easier because they recognized the symptoms much faster. When I was diagnosed, there was they thought it was a few different things at first. There was about a month and a half before they finally figured out it was actually diabetes. For him, as soon as they started seeing the signs, they checked his blood sugar, saw it was diabetes. So we were kind of together in that. And then when we were 7 years old, our parents sent us to a diabetes camp in New Jersey called Camp Najeta. That's where that's where I really became comfortable with diabetes. That's where I learned to give myself injections, to draw my own, so give myself injections. That's where I became much more just comfortable being diabetic and accepting of like, I don't have to, fight it. It's okay to just be diabetic. This is just how my life is. And, I can make it work.
Oh, wow. That's a wonderful option for kids. I hadn't heard of that before. So with your brother then finding out he's also type 1 diabetic, did that create a really close bond with you guys as far as just having something in common?
Yes, in a way, because he was in our household, we were the only two diabetics. We were the only ones who really understood. So, as much as, my family, other family members really wanted to support us, and, take care of us the best they could. They had never felt a low blood sugar. They never felt a high blood sugar. They didn't know what it, they've been told and read the symptoms of being DKA, but they've never experienced it. So having someone I could talk to who actually did know what it felt like when I say I feel low, he knows exactly what that means and how how that urge to just eat everything in sight. So
I'm glad that's not just me, because I was telling my husband the other day how I took like the glucose gummies, and then it's like this, you just want to eat everything because your body's telling you need it. And then I ended up on the other end. It was being high.
Your body's literally telling you, if you don't eat enough right now, you're going to die. Eat everything possible. That's literally what your body's telling you. And it's hard to fight against it. Like, even though intellectually you've eaten enough, when your blood sugar's still not coming up, it's easy to give into. I've done it tons of times. I don't know a single diabetic who doesn't do that on a semi-regular basis, even with Dexcoms.
Yeah.
Mhm.
Yeah. I was type 2 diabetic for years, so I didn't have to do the shots. I was on pills, but even just the little pinprick was a lot at times when you don't do it right. But it's also, like you said, it's so easy to when you're feeling bad because of a low blood sugar, you just want to keep eating, 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 eating to start feeling better. And then you end up in that bad cycle of too high, too low, too high, too low.
Get that roller coaster action going.
Yeah.
Mhm.
Yep.
Yep.
Now, you also mentioned epilepsy. How old were you when you started dealing with that?
I was, I believe, about 16 years old. I had woke. I do this. I very much remember. I was 16. It was a Saturday morning. I had got up. I hadn't checked my blood sugar yet. I had my plan was to get up, take a shower, and then check my blood sugar, eat and everything, and then get ready to go do the day. I got up, got into the shower, and then my next waking memory, I'm in my brother's room, sitting on his bed, fully clothed. My mom is holding me and crying, and I tried to talk to her. I'm just coming to consciousness. When I have grand mal seizures or tonic-clonic, sometimes they're called, depending on who you're talking to. I completely lose consciousness, go into convulsions. I very often bite my tongue. So because I lose consciousness, for me, I was in the shower, then suddenly I'm awake, sitting on my brother's bed, no idea what happened in between. I saw my mom was kind of holding me and crying, and I was like, "What's wrong? I'm trying to talk to her and figure out what's going on." But I had bit my tongue during the seizure. My tongue was so swollen I couldn't talk. Like, it actually eventually, like, it swelled up and turned like it wasn't like, it was like black and blue and green and purple, and it was bad. And then I found out later that when I had the seizure, my mom had heard me fall in the shower, and she started calling out to me, trying to find out what was happening. And when I didn't respond, she could still hear me kind of like flopping around, bouncing around inside the shower, and I wasn't responding. So she started trying to break down the door. Then my brother and my cousin, who were also home, she saw them and told them, like, she told them to, break down the door. Something happened to me. So they break it down, and they both, dragged me out of the shower, put clothes on me. When my mom brought me out, she did recognize that I was having a seizure. And there is a very popular urban myth that if someone's having a seizure, they can choke on their tongue. That is an urban myth. It is not possible. My mother believed that myth, so she put her fingers in my mouth and tried to hold my tongue to make sure I didn't choke on it. And the most common muscle that you lose, one of the most common muscles that you lose control over during a seizure is the jaw muscle. And when it flexes full power. So I bit down on her thumb down to the bone. So her thumb was like you could see the bone. Her thumb was all kinds of messed up for a while. And after that was they got me dressed. And then at this point, I woke up. I was talking to my mom. I was trying to reassure her. I honestly didn't know what was happening, but my mom was crying. It's like, everything's fine. Everything's fine. You don't need to cry. But I'm saying it with my tongue was so swollen that it's fine. So it probably wasn't too encouraging. And then the paramedics came, and I had another seizure at that time. And then next thing, I woke up in the not in the ambulance. I didn't wake up till we got to the hospital. So
and that's so scary. it was basically brought on by a low blood sugar.
Yes.
Is that right?
So when the ambulance came, they gave me glucagon.
Mm-hmm.
So for listeners who aren't familiar with glucagon, it is basically it's a hormone that tells your liver to release stored sugar that it has. And can make your blood sugar come up very quickly, like just a couple minutes, much faster than eating anything. It's not the healthiest thing in the world, but if it's that or dying from a low blood sugar, it's it's the win. So they gave me glucagon before they tested my blood sugar. So by the time they did end up testing my blood sugar on the way to the hospital, I had already had glucagon on board for like 10 minutes. My blood sugar was normal at the time, but they were fairly certain that because it was normal then, it probably was low before. And it was they couldn't be sure how low, but that's their, they couldn't be 100% sure. Obviously they weren't there. But I hadn't checked my blood sugar yet that morning, so I couldn't say for sure my blood sugar was, in good shape before that. But that is the all logic points to it being from a low blood sugar.
So you were taken then to the emergency room. So then how soon did they actually diagnose you with epilepsy?
So I was not immediately diagnosed with epilepsy. They told me that they said I didn't have epilepsy, but I did have a seizure disorder, which they said there was seizure activity in my brain, but after only having one seizure, they didn't feel that it really warranted being like chronic seizures, which would be epilepsy. So that was the only seizure I had for a few years. They put me on medication. I believe it was lamotrigine, and I was on that for it was very low doses of lamotrigine. I was on that for a few years, but so after I had the seizure, before I had the seizure, I was on the football team, and after I had the seizure, I was out of school for a while, and once the football coaches found out, they were scared to let me play. They were terrified that I, get hit and have a seizure on the field. So for the whole season, I practiced and never played. So I actually ended up quitting the team because it's a great workout and all, but I didn't want to. I asked them, is this going to be like a running thing? Is this going to change next year? And he said, honestly, probably not. Like they were scared, and I can't blame them for being concerned about that. But I did end up leaving football, and then for a few years I had no seizures, and then I started having one morning I woke up and my tongue was swollen. This happened when I was living in Connecticut. I was going to a trade school in Connecticut. I was in the dorm. I woke up. My tongue was swollen on one side. I asked my roommates if they'd seen anything. They hadn't seen anything. I went to a doctor, and he said that he thinks it's, I have some kind of allergy that's causing my tongue to swell. I was like, but that would be weird, right? For an allergy for it to only swell on one side of the tongue, one side of the tongue wouldn't normally do the whole tongue. He's like, yeah, that's absolutely, that's really weird to happen for an allergy. Like, so are we sure this is an allergy? He said, yeah. And then so he gave me the allergy medication, and then it happened a couple more times. And I went to another doctor. I went to another doctor, and they told me, oh no, sorry, I did not go to another doctor. Someone saw me. One of my roommates actually ended up seeing me have seizure while I was asleep, and that's when he realized I had been having seizures in my sleep, every couple months for like a year at this point. And that's when I went to the emergency room. and they did, a CAT scan and stuff. And they said, yeah, that was definitely a seizure. And I ended up going to a neurologist. And after they put me on some new medication. And at that point I'd had probably 5 or 6 seizures. So yeah, something like that, like 5 or 6 seizures. So I said at that point they would consider me officially diagnosed as epileptic, because I am now actually having chronic seizures. Then I got put on different medication, some stronger medication. I was put on Keppra and Tegretol. At first it was just Keppra. That didn't work. So the way it works with epilepsy is there's a lot of just trial and error. Mm-hmm. So they try you on a medication. They usually try the one that has like the lowest aggressive side effects. They'll just start you on that. If it doesn't, you still have seizures, they give you more. Still have seizures, they give you more. Still have seizures, they give you more. All right, that's not working. All right, we'll try 2 medications. We do that one and like a low dose of another one. That didn't work. All right, we'll raise the second one some more. Oh, that didn't work. They keep doing it, adding and then changing medications, and they just keep trial and error until they figure it out. If you have reduced seizures on a particular type, then they'll try to go more in the direction, more similar drugs to that one. But it is ultimately just a lot of guess and check.
Mm-hmm. My sister-in-law is epileptic, and I know some of the medications that she's been put on caused a lot of weight gain. Did you have any issues with that?
I did not have weight gain. I had plenty of side effects, just not that one in particular. Mm-hmm. I had so when I was on Keppra and Tegretol at the same time. At that time, I was in college at Delaware State University. I was at the beginning of my 3rd year when they added in the Tegretol, and it messed up my concentration so bad. I had been Dean's List every semester up until then. My GPA dropped to like a 1.6. I just couldn't focus. I couldn't concentrate. Like, it was just constant mind fog. I remember sitting in class. I'm trying my hardest to concentrate, but teacher sounds like, Charlie Brown's teacher, just womp, 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 womp. I can't understand where the words are coming in one ear, right out the other. Like, I couldn't focus on anything. I was spending all of my time, I stopped going out. I stopped doing anything because I was trying to, just not fail. So I wasn't spending any time with my friends. Every day I was just in there doing homework, studying just every night. And it took me so much time just to get through the homework because I kept losing focus and losing concentration. And then in the lessons, it was hard. So it was, my GPA dropped so much that I changed schools a couple of times. I ended up going to trade school. And by then I had adjusted a little bit better to the drugs. And I could concentrate enough to get through the classes. Mm-hmm. This is when I was at Del Tech at that point.
While you're on your phone, come on, I know it's in your hand. Head on over to Spoonful of Strength's Etsy shop at spoonfulofstrength.etsy.com. That's spoonful with 2 L's. We have a wide variety of t-shirts, sweatshirts, hoodies, mugs, and so much more. Anything in the shop can be customized based on your illness. We have sizes from extra small to 5X and many colors to choose from. The best part is most items ship within 2 business days. So head on over to spoonfulofstrength.etsy.com. Sounds like there's a little bit of similarities between, because with diabetes, everything's always changing and the amount of insulin you need and all that. So I'm sure it's quite tricky. But when you have a seizure, can you like feel it coming on? Like what can you feel or what can you notice when you're approaching a seizure and while you're in the seizure?
Sometimes I can, sometimes I can't. my doctor told me, so I've taken several EEGs, electroencephalographs. They hook up electrodes to my head, and then they take measurements of brain waves. They flash lights in my face and do all kinds of things to try and induce seizure activity. And what my most recent neurologist told me was that leading up to a seizure for me, a lot of times I'll have, they're called subclinical seizures. They're basically like micro seizures. It is a seizure, but it's small enough that it doesn't outwardly show as a seizure. Like they can measure it on an EEG. It would show up on an EEG, and they can see that it's clearly a seizure, but I wouldn't react as I normally would to a seizure. So for me, when I'm having that series of subclinical seizures leading up to a seizure, I keep losing focus. Like I'll lose my train of thought like every few seconds. I can't go more than a few seconds without like forgetting what I'm doing, even forgetting where I am. Even like I was like one time I was at home, and I just like walked into my living room like, when did I get home? I've been home all day. It's like when did I get home? Why am I here? What am I doing? And my doctor, she has told me that I was, in fact, for me, that's the closest to an aura I'll get. It's not a true aura like some epileptics have.
Or how do you feel as you're coming out of the seizure?
Yeah. So when I come after the seizure, I feel I have the worst headache imaginable. And I can't think, I can't concentrate, like walking is difficult. Just like the sound of myself talking, like I can feel my voice vibrate in my head, and it just hurts so bad. And I'm tired, just beyond tired. Sleeping for, I'll spend pretty much all my time sleeping for the next 2 to 3 days after a seizure. Wake up to like eat and go to the bathroom, and that's pretty much it. Other than that, just right back to sleep. So that's every seizure's, it's not just like a medical problem. It's like for just on a day to day, like just I'm losing several days of anything I was doing. Like if I'm in school, that's, I've missed tests. I had a seizure in the middle of a final once. That was obviously terrible. And speaking of school, my 2 biggest triggers for me that cause me to have seizures are lack of sleep and stress. So you can imagine college was great.
Yep.
Caffeine also can set me off. So no caffeine.
So nothing to combat that lack of sleep.
No.
Throughout the day, no chugging your coffee to keep you awake. How has it impacted, especially like looking back at your college years too, your social life?
It has impacted me a lot. One of the things, one of the other things that can cause seizures for me is alcohol. So I didn't drink much. I didn't really drink at all until I was like 23. And then even then I still didn't drink very much. And also staying out late. I obviously couldn't do that because I needed sleep. So like my social life was very, very limited to just, what I could do during the day. After I was done with, I go to school, I go to work, I do my homework. If there's, that by then it's usually, I have to go to bed if I want to get any reasonable amount of sleep, because I'm not worried about just being tired in the morning. I could have a seizure, and that's significantly worse. I got into martial arts, kind of as a kid, and kind of did it kind of on and off my whole life. And while the diabetes was a more like consistent issue, as it is with anything, with any type of sports or athletics, the epilepsy particularly because I was doing like contact sport, getting hit in the head was a concern for a long time. Still kind of is, but I've talked to my doctor about it, and she thinks. So right now I'm doing judo, and she said she thinks right now I'll probably be okay. So something like boxing. I used to do Muay Thai. She says something like that, or getting like just getting punched in the head, punched and kicked in the head, elbowed in the head on a regular basis. That's definitely bad. But judo, she said, might be that's she doesn't think that's as bad.
Mm-hmm. I'm glad that you've been able to find an outlet, something that so far seems to be working for you. Now, I usually ask everybody who comes on here, the mental part of chronic illness. You're dealing with 2 serious illnesses. How do you manage the mental health part of dealing with the diabetes as well as the epilepsy?
So the diabetes part of it, actually going to the summer camp helped me out significantly with that. Not only did I learn, to live with diabetes, but I also made a ton of friends who are also diabetic, who I can talk to about it. And, when the diabetes gets frustrating, like I can just, tell them and text them and just be like, it's just one of those days. Like they get it. There's days where, diabetes just doesn't want to follow the rules. Sometimes there might be a day where I'm taking, ridiculous amounts of insulin. My blood sugar just refuses to go down. Taking tons of insulin, more insulin, more insulin. My blood sugar is not going down. I'm not eating anything still. My blood sugar is not going down. And other days where I've been eating nonstop all day, I disconnected my pump, first thing in the morning because my blood sugar was low. Hasn't been on all day. I've been eating constantly. My blood sugar has just been low all day. Those days just happen. Those days they're frustrating. And it's like having people that I can reach out to and just be like, man, it's one of those days. They're like, yeah, I get it. It does help. And even just knowing that, even if I don't reach out to them, just knowing that like there's people I know who've dealt with it. I'm like, they've dealt with it too. Like, where I'm not alone in it. Even my brother, sometimes I'll just call my brother. It's like, what's going on, man? I'm just having one of those I'm having a bad diabetes day, man. He's like, high or low? Low. And having someone to talk to who gets it and knows what it's like is a huge help. And for the epilepsy is frustrating. And it has, so another side effect the mental aspect of epilepsy, another side effect I didn't mention was, so recently I've gone through a few new medications that have had different side effects. One of them, for a little while, I was having like these like night terrors. For one of them gave me I had depression, like acute depression. Like it came on really fast, and I only had it for like a week, but it was a bad week. And then they changed my medication again because of the side effects, and the new one they put me on then gave me like serious like anger issues. Like I was things that I normally just absolutely brush off and not bother me in the least bit, like things like perceived, just be like a perceived rudeness or something like that. Now I was ready to get violent. I was very angry, like just over nothing at all. So partly to deal with that, I took up meditation to help deal with the mental problems I was having with the epilepsy. That's helped. And I've been, it was hard to get into. Meditation is one of those things that's like at the beginning, it feels like it's not doing anything. And honestly, in the beginning, it wasn't because I wasn't good at it yet. But as weeks, went on, months went by, I got pretty good at it, and I was able to, anytime I feel myself getting, you know, angry, like in a way that's, very out of character for me, I can feel it for what it is, and then just quickly slip into meditation and, calm it back down. So yeah, it's for mentally, I feel that in my particular situation, the epilepsy is more consistently an issue. But dealing with them together, like alternating between one and the other, sometimes both at the same time, there's a, like, if I was having one of those angry episodes at the same time as like a low blood sugar, that's, that's a really bad day.
They like to team up. I have the same thing, it's like it takes turns, and then you have those horrible days where everything's just, not working right.
Yeah. Yeah, exactly.
I was diagnosed with type 1 diabetes in 98. And I know you were a couple years before me, but isn't it amazing how how everything with diabetes has changed so much? Do you have like a CGM and insulin pump and all of that?
Yes, I have a T-Slim insulin pump with the Dexcom CGM, and you're right, the technology, how much has changed just in our lifetime has been incredible. Yeah. And when I talk to, like I said, but through the summer camp, I've met older diabetics, and they've seen it come even farther. They used to, before testing your blood sugar with like a glucometer, before that, and even when I was a kid, the glucometer, you had to use so much more blood. That was just probably around when you started too, like so much more blood. And they had like a long, like 30-second to a minute countdown. It took so long. And then they'd fail a lot. So then you do all that blood, and then you wait the 30 seconds just for it to say error, do it again.
Yeah. I saw a book. This was when I was newly diagnosed. Somehow my husband found a book, and it had a picture of the first insulin pump, which was like from like 1970. And it literally looked like a jetpack. It had like, it looked like a big backpack, and it was all metal. And so they used to laugh at me at that time, they didn't have insulin pumps, so they weren't widely used. But I'll have to see if I can find it, and I'll send it to you. But it looked like one of those jetpacks, and so it was so funny. It's just amazing how much they've come. So it
went from that to now they're working on they're now working on the Beta Bionics pump. I don't know if you've heard about this one. So the Beta Bionics they call it the eyelet pump. So it's supposed to be the first true closed loop insulin pump. So it has a CGM and an insulin pump, but the insulin pump doesn't just have insulin; it also has glucagon, so it can treat highs and lows. So you don't do anything. The CGM talks to the insulin pump; it pushes your blood sugar up or down depending on what your blood sugar is. You don't check your blood sugar, you don't count carbs, you don't do anything. It does everything all on its own.
Yeah. Oh, that's. I just recently got an Omnipod, which is the tubeless pump, and that's been really, really nice. So a lot of things that have come in the 30 years that I've been dealing with this. But is there anything that you want to share with our listeners as far as your journey, or any piece of advice anybody dealing with diabetes or epilepsy?
If you're, for people dealing with diabetes, or in particular for parents who have children who are dealing with diabetes, if you have the opportunity to send your child to a summer camp, I would advise it. Just anything that get them someone, or the more people they can talk to who can relate to the diabetes, the better. Because no matter how much you love your kid, you've never experienced a low blood sugar, so you can read it's like anything else, you can read as many books as you want about what it feels like, but you've never actually felt it, So like getting them somewhere where they can talk to other people and just, have people they can talk to about it, it makes a big difference. And it also helps them get more independent. Seeing other kids who can do it themselves. That's what happened to me. I was terrified to give myself insulin. Then I went to the summer camp and I saw other kids doing it themselves. I was like, well, if they can do it, why can't I? And I just asked them, they're like, hey, can I try and give myself my shot this time? I said, absolutely. And, I started giving myself shots. And yeah, just over the first camp session I went to was only a week. My parents left me for a week, came back. I was giving myself shots. They never had to give me one again. And for adults, you got it as an adult, which I personally think is much more difficult. Because while on the one hand, you're an adult, you're more mature, you can understand the importance of what it is you're doing. You also already have a life. You've got, you've got a job, you've got, maybe you're in school, maybe you've got kids, you've got a whole life going on already. And now you're throwing diabetes on top of that. I don't remember not having
bigger adjustment. Bigger adjustment versus growing up that way.
Yep, absolutely.
Yeah,
absolutely. For people with epilepsy, don't give up. It can, especially some people have it really bad where they have, like one guy I met, he was having, up to 10 seizures every day, when it was at its worst. And that can put people in a really bad place mentally. He was ready to end it. And don't give up. Like, there's a lot of medications out there, and I know it's hell. I know, especially if you're having them that often. I never had them that often, but I know that's got to be just hell day after day. But you might have to, don't be afraid to try a different neurologist or try a new medication, or, just, you have to be, especially in the beginning, you kind of do have to fight your epilepsy. Take whatever advice they give you. They tell you, stay on top of your sleep. Don't drink alcohol. Avoid stress. Take up meditation or whatever it is you do to reduce your stress. Do all of that. It works. It really does work.
Great.
And if you feel like your doctor's not doing, it's just not taking an approach that's working, and they keep trying the same thing and it's not working, and they're refusing to change, get a new doctor. Like that is in your power. You have with diabetes also. If you're a doctor, if your endocrinologist or your neurologist is not meeting your needs, you can change doctors. You're allowed to do that. Go to your most health insurance now. They have a website or an app. You go in there and look up neurologists, look up endocrinologists, try somebody else, read there. If you're involved in something like Reddit, Reddit's got subreddits for diabetes and epilepsy, somewhere like that where you can meet other people online. Just ask them, like, hey, I'm in Delaware, I'm in North Delaware. Anybody know a good neurologist, a good endocrinologist? Reach out to people and ask. It is your health, it's your body. Advocate for yourself and find the person who will help you take care of you the best.
Perfect.
Thank you so much for joining us, David. We really appreciated having you on here and sharing your story and great advice for those that are going through with epilepsy and diabetes and living with that on a daily basis. We really appreciate having you join us.
Glad to be here.
Yeah,
and
great.
Have
Awesome.
a wonderful rest of the week.
Yeah.
You too.
It was fascinating having Dave on, just because having type 1 diabetes, I don't really know anybody that has type 1 diabetes. And so it was really nice to be able to kind of relate to him. And even though he was diagnosed very young, and I was diagnosed at 21, it was nice to be able to kind of relate to him about his diabetes, and really, really happy that we were able to connect with Dave and have him talk about his type 1 diabetes and his epilepsy. So next week we have a really interesting episode. I'm really looking forward to it. We have Di, the yoga witch. She also has many different chronic illnesses, including fibromyalgia, endometriosis, POTS, and some other illnesses that she is going to talk about. But she's also a tarot card reader. And so we're going to talk a little bit at the beginning of the episode with just Tina and I. We're going to talk about spiritual beliefs and how having a spiritual belief might benefit your chronic illness. And then we're going to bring Di in to talk a little bit about her background. And she has agreed to do a tarot card reading for Tina and I. So I'm really excited about that. So it's going to be a fun episode. And yeah, I think, have you had your tarot cards read before?
I have a few times, and I have a few decks. Actually, I have a few Oracle, which are very similar to tarot cards.
Yeah.
So I actually do enjoy. It's been a while since I've pulled them out, but I'll occasionally pull them out and do my own reading for myself. So, but I always appreciate and enjoy someone else doing a reading for me.
My son's girlfriend, not professionally or anything, but she's very much into tarot cards. And so she's read me a little bit before, but I haven't had like a full on session. And I'm always open to all this, anything and everything. I'll try it once. But I'm really interested in how that works and how accurate it is. It sounds like it's going to be a lot of fun. And so we're going to have some fun next week. Have a great week. We're going to be back here next Tuesday. And we hope that your week is full of joy and less of pain. Enjoy it, and we'll see you next week. Take care. Don't forget to follow the podcast, click on the bell to receive notifications on new episodes, and give us a rating. Feel free to send us a comment on the episode you just listened to. Thank you for being a loyal listener.